Hello, it's Jeremy Faust, Medical Editor-in-Chief of MedPage Today. I'm very excited to be joined by Dr. Debra Houry. Dr. Houry is and was an emergency physician before going to the CDC in 2014, where she rose eventually to her final title before resigning several weeks ago. Her title was Deputy Director for Program and Science and the Chief Medical Officer of the CDC. Her resignation, along with several colleagues, came in the wake of the CDC director's forced resignation or forced departure by HHS. And Dr. Houry has been very outspoken in defense of the CDC and its capabilities. Dr. Houry, thanks for joining us.
My pleasure.
What was it like for you these last 7 months?
I tell people it was a a test of my leadership. I think I learned a lot about compromise, being an authentic leader, and not compromising when it came to things like science and data. I pushed back when and where appropriate and held the line until it was time to move on.
Can you tell us some places where you really felt you had to stand up for public health, science, and data, and that you were able to?
Yeah. So, one of and many of the things that I did, will never be seen because, it went okay. And, one example is, when a document was sent to me on thimerosal, the final memo before it went to the department, I did not agree with much of the information that was in it. And so I pulled information off of our website, our prior document, to define what is ethyl methyl mercury, to put it in context, to have complete paragraphs versus half paragraphs because I thought full context was important. And when I did that, it was kind of like, well, we don't like what's in this. And I said, well, I have to put it in to counter, what is not scientific. And so we pretty much just took all of it out, just listed how often thimerosal was used and what the vote was, because I had to at least put in the appropriate scientific context to balance what I thought was not scientific and was historical in there. And so, that was something I did because if I knew I had to sign off on it, it had to be appropriate. And so I could only sign off on what the actual numbers were.
And I think I would be remiss if I didn't mention something towards the end of your lengthy service, which was the shooting on August 8th. Can I
Yes.
just ask, how are you doing? Were you there? And how is everyone at the agency doing?
Yeah, the shooting, I think it's going to have a long impact on CDC. And certainly, we saw during COVID how many state health officers left their jobs because of threats of violence. I had just left 10 minutes before the shooting had happened. And when I got the call, my initial response as an ER doc was to run back, but I was told not to. And so I stayed on the phone with my staff and my leaders who were there until 11:30 p.m. at night, as many were on lockdown. So I was talking with them as they saw the shooter, as they saw, the police cars coming in, as they were waiting for the marshals to clear them. I did FaceTime with, hundreds of people that were stuck in conference rooms. And what I really took away from it was not just the physical trauma, and Officer David Rose, who gave his life to protect my staff and my colleagues, is just the long lasting impact it has. People felt personally targeted. CDC was targeted by a violent assailant. And so people that do work on vaccines or other high profile topics don't want to publicly speak anymore and or want their names off papers. And that is not good for science. And this is where things like misinformation that result in violent rhetoric has got to be stopped.
And where do you think that you said that you're worried that, like the threats that happened during COVID, this would lead to resignations? Do you think that others should follow your lead in a way?
Yeah. So I think, as you know, this was a super tough decision for me to leave CDC. I love CDC and been through many different administrations and navigated all that successfully, and was really proud of the work that my teams of thousands of people do every day. But when I left, I think most people know I'm a thoughtful person, and I don't just say things without a lot of backing. And so I was extremely concerned about the state of public health in our nation and honestly globally. And so I thought it was time to really raise what I keep calling the bat signal. And so Dan Dimitri and I had planned this. I actually had held on to their resignation letters for several days in my inbox without a date, because I was their boss. So I was able to sit on their letters. And then when it was time, I pushed all three at the same time. Um, I don't necessarily want other people to resign. My resignation was to alert what was going on in public health. And if Congress will allow, CDC to function as it should and make sure it has the appropriate resources. And the secretary allows our scientific experts to do things in a data-driven way and not ideologic. That's what's important. I think there probably will be other resignations based on what I've been hearing from some of my former team, but I have told everybody to stay for right now and just see if what we have done has helped. And if it doesn't, then I understand.
If the next group comes in and they see what you saw, they feel what you felt, at some point, are you worried that they too will encounter the same conditions? And then at some point, you run out of people who've been there long enough to know what they're doing, right?
Yeah, I think what I would say is, at least to my leadership team, I was a pretty authentic and genuine leader and let them know about, issues I was handling, because I was doing my best to protect them and their programs. And so I thought it was important that they be aware of the whole landscape. I think Dimitri and Dan did a similar thing. They were pretty, open with their team. So I don't think anybody stepping into one of our jobs would be, oh my gosh, I had no idea. I think that's honestly probably why it's now been 2 weeks. And to my understanding, there is not an acting chief medical officer at the CDC. So Dan and Dimitri and Jen's positions have been filled by actings, but mine has not to date. Certainly, I think they will need to fill that, as that job oversees all the national centers in the Office of Science. But when you talk about who else can step in, certainly there's external people that can be hired. I came from outside to run the National Center for Injury Control, as did many center directors. There's great public health talent across the agency, but also outside the agency. Yeah. So I do think this is just times for, different leaders to jump maybe before ready. I've always said, by the time you think you're ready for a position, you're probably already past it. You need to stretch yourself and, learn a bit while you're on the job.
So as you just told us that there's no chief medical officer at the Centers for Disease Control, and do you expect that will be someone, if they fill that role at all, from the CDC, or would it be someone from the outside? And the reason I ask is, so far the administration has brought people in from the outside, but other than the now fired director, Dr. Susan Monarez, they're not really scientists at all. And so will the chief medical officer be a scientist, be a physician, be someone who actually has training, or will it be another sort of lawyer from RFK or Trump world?
Yeah, so I can't really speak to that as I'm not part of those discussions anymore. But the position description I had did say you had to have an MD and medical training. So if they use that, then you would need that to select. Certainly, there has been an increase in political appointees at CDC. I think the previous administration there were maybe 2 or 3. I think my last count is there were 11 at CDC, and so my guess is that there might be a political appointee for my position, my former position.
But you think that they actually might be a scientist or a physician as opposed to some of these lawyers?
I do not know. Okay. I do not know. They have not engaged me for my opinion.
I assume you think that matters, right? Because there is something to be said for, you don't have to be one of us necessarily for every role. You've had a lot of people run HHS who were not scientists. You've had Alex Azar, you've had Becerra. It's just not that part's not unprecedented. But it is unprecedented, as far as I know, to have an acting CDC director who is not a scientist or a physician. Is that correct?
Yes. And so that's why I do think having a scientific bench is really important. Susan wasn't a physician, and I was able to, help Susan with, clinical decisions. And so now having the deputy secretary be the acting CDC director who's not a scientist or a physician, you certainly need somebody, I think, and his leadership team that can provide that counsel.